Why are you experiencing painful menstruation? Today, we are going to look at some of the causes of dysmenorrhea and how you can treat them. Hello, my good listeners. Welcome to my channel. My name is Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So, let us look at dysmenorrhea. Dysmenorrhea is the pain that is associated with menstruation. Most women could tell you that they experience this pain in the lower back, and sometimes it radiates to the thighs and to the back. We have two types of dysmenorrhea. We have the primary dysmenorrhea and we have secondary dysmenorrhea. Primary dysmenorrhea is associated with no structural abnormality. There is no underlying cause to this, and this mostly occurs in young girls when they start menstruation. So you find that they start having that pain from when they start menstruation. And so, what are some of the causes of primary dysmenorrhea? Primary dysmenorrhea is caused by high prostaglandin levels in the bodies of these women. So, when these people have high prostaglandin levels, prostaglandin leads to contraction of the uterine wall. Increased contraction of the uterine wall now leads to constriction of the blood vessels in the uterus. And when the blood vessels constrict, now this reduces blood supply to the uterine muscles. And when there is reduced blood supply to the uterus muscles, now this means there is low oxygen supply to the uterus muscles, and this can lead to pain. Again, these women experience heavy bleeding, normally with a lot of clots. And so the uterus contracts trying to expel these clots. And when the uterus contracts, the cycle goes back, whereby now it leads to the constriction of the uterine blood vessels. And when the blood vessels constrict, this reduces blood supply to the uterine muscles. And when there is lower blood supply, this reduces the oxygen supply and hence causing pain in this woman. Okay, and so some of the risk factors that are associated with primary dysmenorrhea are things such as family history. You find that some of the women with primary dysmenorrhea have relatives, such as maybe their mother or their sister, who had this primary dysmenorrhea. Again, it is associated with early menarche. When you receive your menstruation very early, maybe you find some girls experiencing their menstruation at 9 years. And this could be a risk factor to dysmenorrhea. Another factor could be obesity and even smoking. So let us look at secondary dysmenorrhea. Secondary dysmenorrhea is associated with an underlying cause. There is a structural or a pathological abnormality somewhere that is causing this secondary dysmenorrhea. You find that some of these women never had pain during their menstruation, but at a particular point in time, they started experiencing pain during their menstruation. You find that this pain is usually begins even before they start their menstruation. Like 2 days, they start experiencing their pain before menstruation, and now it intensifies during menstruation. And so, what are some of the causes of this secondary dysmenorrhea? Secondary dysmenorrhea could be caused by things such as endometriosis. We have not talked about endometriosis, but we are going to look at endometriosis in our next video. Endometriosis is whereby the uterine lining attaches itself or implants itself outside the uterus, and we shall see that endometriosis is associated with a lot of pain, and this causes secondary dysmenorrhea. Another cause is adenomyosis. Adenomyosis is whereby the uterus lining implants itself now in the uterine muscles, and also this is associated with a lot of pain. Other causes are things such as fibroids that could grow in a woman's uterus. Another thing are ovarian cysts and also polyps that grow in the pelvic region. Some infections such as the pelvic inflammatory disease could also cause secondary dysmenorrhea. And so, we have understood dysmenorrhea. We have understood some of the causes of dysmenorrhea. We have understood the types of dysmenorrhea. Now, how do we treat dysmenorrhea? If you come to me as your pharmacist, how will I help you treat dysmenorrhea? So, number one, I could advise you to exercise frequently. Exercise releases the hormones that we call endorphins, which are like feel-good hormones, and these could really help alleviate your pain. Again, I could also advise you to do warm presses, or maybe having a hot water in a bottle and pressing it against your abdomen. This could also help you relieve the pain. Some of the medications that your doctor may prescribe for you are such as NSAIDs. NSAIDs is a class of drugs including drugs such as ibuprofen, diclofenac, mefenamic acid, ketoprofen. These drugs inhibit the synthesis of prostaglandins. We saw that prostaglandins leads to the contraction of the uterine wall, leading to reduced blood supply, reduced oxygen supply, and hence a lot of pain. And when these drugs inhibit the production of prostaglandins, then they help you alleviate your pain. However, these drugs should not be taken by women with gastrointestinal ulcers, women with gastritis, women with bleeding disorders, or also women with asthma. These women can talk to their doctor and they can find you alternatives such as Panadol. However, Panadol is known to alleviate mild pain and not very severe pain. Another treatment option that we could use is the oral contraception methods. These methods are known for ovarian suppression. You find that they inhibit menstruation and the pain that is associated with it. And there you have it, guys. I hope you have understood the causes of dysmenorrhea and how we can treat dysmenorrhea. If you like this video, please give it a thumbs up and hit the notification bell down below. If you have not subscribed, please subscribe. Till next time, guys.